Into emergency rooms in Lubbock lately, you know there isn't an empty seat in the waiting area. It's a situation that is frustrating to not only the patients, but also the doctors.
KCBD News Channel 11's Natalie Falconberry joins us in the studio now with a look at what medical professionals say is the cause of those lengthy wait times. Natalie?
Karen and Abner, ER wait times are something that many viewers have brought to our attention over the last few months, sharing their concerns about the timeliness of care they're receiving at Lubbock hospitals. I took those concerns to both UMC and Covenant leaders who tell me these issues are not unique to Lubbock.
December was a record volume month. There at University Medical Center, we saw over 7,000 people in the emergency department.
Dr. Christopher Peel, the chief of emergency medicine at UMC, tells us a large number of those patients were not in need of emergency treatment.
If you just have minor cold, flu symptoms, cough, runny nose, low-grade fever, minor cuts, minor burns, those can go to the urgent care or a more minor access point for health care.
Peel tells us another reason for those wait times is the amount of transfer patients Lubbock hospitals take from surrounding areas who aren't as equipped for care.
When you're waiting on emergency care in our waiting room, and we still have ambulances coming in and helicopters landing, but we have a duty as well to serve those people, and so we do the best that we can to make sure everybody receives safe and timely care.
An issue that's looming over Covenant Health as well. April Hayes, the executive director of emergency services, tells us the volume of people flooding into ERs is a snowball effect from the pandemic.
You have to remember there were lots of patients that put off their care and treatment, some to their demise, making them more ill and things like that. Subsequently, we've been seeing maximum capacities.
Another lasting effect of the pandemic, Hayes tells us, like many other hospitals, Covenant lost healthcare workers. She says that's why it's vital that you only seek emergency care if it's necessary.
The patients with the minor needs are the ones that end up waiting the longest. And what people don't understand is emergency departments are, very static. They only have so many beds.
Both UMC and Covenant recommend utilizing urgent care facilities first before making that trip to the ER. Karen and Abner.
Thank you, Natalie.